Orthostatic hypotension is defined as a decrease in systolic blood pressure of 20 mm Hg or a decrease in diastolic blood pressure of 10 mm Hg within 3 minutes of standing when compared with blood pressure from the sitting or supine position. Symptoms of orthostatic hypotension include lightheadedness, weakness, blurred vision, and syncope or passing out. Dehydration, blood loss, and anemia are the most common reasons to develop low blood pressure when standing. Beta blockers, other high blood pressure medications, and medications such as sildenafil, Viagra may all cause orthostatic hypotension. Vasovagal syncope may cause symptoms of fainting when the vagus nerve is stimulated by a noxious stimulus, either physical pain or emotional. Diagnosis is often made by history and physical examination. Injury from falling is the main complication of this entity. Maintaining adequate hydration is the best way to prevent orthostatic hypotension if the hypotension is caused by dehydration. However, overhydration can exacerbate congestive heart failure. Patients with CHF and orthostatic hypotension need to closely monitor fluid intake and make changes only with physician supervision. Orthostatic hypotension? When a person stands up from sitting or lying down, the body must work to adjust to that change in position. It is especially important for the body to push blood upward and supply the brain with oxygen. If the body fails to do this adequately, blood pressure falls, and a person may feel lightheaded or even pass out. Orthostatic hypotension is the term used to describe the fall in blood pressure when a person stands. Orthostatic equals upright posture of the body, hypo equals less plus tension equals pressure. Adequate blood supply to the body's organs depends upon 3 factors: 1. A heart strong enough to pump, 2. Arteries and veins that are able to constrict or squeeze, and 3. Enough blood and fluid within the vessels. When the body changes position, a variety of actions occur involving all parts of the cardiovascular system as well as the autonomic nervous system that helps regulate their function. The autonomic nervous system can be considered to run in the background of the body, regulating body processes that we take for granted. There is a balance between the sympathetic system, adrenergic nerves, that speed things up, and the parasympathetic system, cholinergic nerves, that slow things down. These names are based on the type of chemical that is used to transmit signals at the nerve endings. Adrenaline, from the sympathetic nervous system, allows the body to respond to stress. Imagine seeing a bear in the woods. Your heart beats faster, your palms get sweaty, your eyes dilate, and your hair stands on end. Acetylcholine is the chemical that is the anti-adrenaline and is involved in the parasympathetic nervous system. These two systems are in balance, and yet need to respond to routine changes in the body that happens throughout the day. When the body moves to a standing position, pressure monitors, baroreceptor cells, located in the carotid arteries and the aorta sense a subtle drop in blood pressure because of gravity, which causes blood to flow towards the legs. Almost immediately, the sympathetic system is stimulated, causing the heart rate to increase, the heart muscle to contract or squeeze more forcefully, and blood vessels to constrict or narrow. All of these actions serve to increase the blood pressure so that an adequate amount of blood can still be pumped to the brain and other organs. Without these changes, gravity would cause the blood to remain in the lowest part of the body and away from the brain, causing symptoms of lightheadedness or even passing out. Orthostatic hypotension is not a disease or a complaint from an individual, it is an abnormal change in blood pressure and heart rate associated with an illness. What are the risk factors for orthostatic hypotension? Orthostatic hypotension most often occurs in the elderly. Hardening of the arteries or atherosclerosis that develops as we age makes it more difficult for blood vessels to adapt quickly when necessary. As well, many of the diseases that are associated with orthostatic hypotension are progressive, with symptoms worsening with age. Pregnancy is associated with orthostatic hypotension. As the pregnancy progresses, the volume of the circulatory system expands and blood pressure tends to fall. This may lead to lightheadedness when standing quickly. Blood pressure levels return to normal after delivery. Excessive sweating due to physical exertion and exposure to heat are risk factors and potential causes of dehydration and symptoms of orthostatic hypotension. Patients who have other risk factors to develop orthostatic hypotension have an increased risk if they become even mildly dehydrated. Chronic alcohol use and drug abuse are also risk factors for developing symptoms of orthostatic hypotension. When should I call the doctor for orthostatic hypotension? Feeling faint or lightheaded is not normal. While a rare episode that can be explained by circumstances, such as working or exercising in the heat, may be ignored, more frequent occurrences should be investigated. If a person passes out and is unconscious, even for a short period of time, is never normal and medical care should be accessed. The treatment for orthostatic hypotension depends upon the underlying diagnosis. If the cause is dehydration, then fluid replacement will resolve the symptoms. If it is due to medication, then an adjustment of the dose or change in the type of medicine taken may be required. Compression stockings may be considered to help prevent fluid from pooling in the legs when a person is sitting or lying down. This allows for more blood flow to be available to the brain when changes in position occur. Medications may be of use, again depending upon the underlying cause of the orthostatic hypotension. For those who are otherwise healthy and have no specific illness that must be treated, increased salt and fluid intake may be recommended. Caffeine and nonsteroidal anti-inflammatory medications, for example, ibuprofen, may also be suggested. Some patients may be a candidate for fludrocortisone, Florinef, to increase the volume of fluid in the blood vessels. Fludrocortisone is an adrenergic, adrenaline-mimicking, drug, which stimulates the sympathetic nervous system. This medication does have significant side effects, including lowering magnesium and potassium levels in the blood, headache, swelling, and weight gain. What are the complications of orthostatic hypotension? Falling is the most important complication of orthostatic hypotension. Most often, the symptoms are transient and self-limiting, giving the patient a chance to sit down, but when the drop in blood pressure causes syncope, fainting, or near syncope, it is the trauma that is sustained in the fall that causes the most damage. How can orthostatic hypotension be prevented? Since dehydration is the most common cause of orthostatic hypotension, it is important to minimize the risk by keeping adequately hydrated. This is especially important if an individual works or exercises in a hot environment. Fluid lost from vomiting, diarrhea, and other illnesses that are associated with a fever should be replaced as best as possible. Patients taking new medications that may affect the autonomic nervous system should be aware of the potential for orthostatic hypotension and report any symptoms to their health care practitioner.